As we age, health becomes an increasingly important topic. Routine checkups, preventive screenings, and medical tests are a big part of maintaining well-being. However, not all medical tests offer benefits in our later years, especially after turning 70. In fact, some can lead to more harm than good, including false positives, unnecessary anxiety, invasive follow-ups, and exposure to radiation or medications. While the intention behind many of these tests is good, older adults must weigh the potential harms and benefits based on their individual health, life expectancy, and personal values. In this comprehensive guide, we will explore 5 common medical tests that many experts and organizations suggest older adults over 70 may want to reconsider. Each section will delve into what the test is, why it might not be beneficial past a certain age, and what alternative approaches may be more appropriate. Section 1. Colon cancer screening, colonoscopy. Colonoscopy is a routine screening method for colorectal cancer and is typically recommended every 10 years starting at age 50. However, for people over 70, and especially those over 75, the potential harms may begin to outweigh the benefits. Why it might be harmful. Preparation for a colonoscopy can be physically taxing, involving strong laxatives that may lead to dehydration, electrolyte imbalances, or confusion in older adults. The procedure itself is invasive and carries risks such as bleeding, perforation of the colon, and complications from sedation. The detection of benign or slow-growing polyps may lead to unnecessary follow-up procedures or anxiety. Studies suggest that it takes about 10 years for the benefits of a colonoscopy to manifest in terms of cancer prevention. For individuals with limited life expectancy due to age or comorbidities, this benefit may never be realized. Expert recommendations. The U.S. Preventive Services Task Force, USPSTF, advises against routine colorectal cancer screening for adults age 76 and older unless there are specific high-risk factors. What to do instead. Discuss less invasive alternatives, such as fecal immunochemical tests FIT or stool DNA tests with your healthcare provider. Focus on symptoms and changes in bowel habits rather than routine screenings. Section 2. Prostate-specific antigen PSA test. The PSA test is used to screen for prostate cancer in men, but has been a subject of controversy, especially for older men. Why it might be harmful. Prostate cancer often grows very slowly. Many men over 70 will die of other causes before the cancer becomes a threat. A high PSA level can result in further invasive testing like biopsies, which carry risks of infection and bleeding. Treatment for prostate cancer, surgery, radiation, hormone therapy, may lead to significant side effects such as incontinence and impotence, which can greatly impact quality of life. Overdiagnosis is common, meaning many men are treated for cancers that would never have become clinically significant. Expert recommendations. The USPSTF recommends against PSA-based screening for prostate cancer in men age 70 and older. What to do instead. Focus on symptom management and regular physical exams. Talk with your doctor about personal and family history to determine if continued screening makes sense. Section 3. Mammograms for breast cancer. Mammograms are essential for early detection of breast cancer, but after a certain age, the risks and benefits need to be reconsidered. Why it might be harmful. Like prostate cancer, many breast cancers in older women grow slowly and may never cause symptoms or lead to death. False positives are common and can lead to anxiety, additional imaging, and sometimes unnecessary biopsies. The psychological burden and physical discomfort from frequent testing may outweigh the benefits. Older adults with other chronic conditions may not benefit from the early detection that mammograms offer. Expert recommendations. The American Cancer Society recommends that women with a life expectancy of less than 10 years should not continue breast cancer screening. What to do instead? Consider clinical breast exams and be attentive to any new symptoms. Maintain open communication with your healthcare provider about the pros and cons based on your individual health. Section 4. Bone density test DEXA scans. DEXA scans are used to measure bone mineral density and assess the risk of fractures due to osteoporosis. These tests are generally recommended for women over 65 and men over 70. Why it might be harmful? While the test itself is not harmful, the treatments that follow might be: medications prescribed for osteoporosis, such as bisphosphonates, can cause side effects including gastrointestinal issues, jaw osteonecrosis, and atypical femur fractures. In people with limited mobility or already reduced physical activity, the benefits of such treatments are less clear. Repeated testing often does not significantly change clinical management in very elderly patients. Expert recommendations. Reassessment of fracture risk should be individualized and based on previous fracture history, lifestyle, and mobility. What to do instead? Focus on fall prevention strategies, including exercise programs, home safety, and vitamin D/calcium supplementation. Consider DEXA testing only if the results will directly influence treatment decisions. Section 5. Annual full body scans or routine imaging. Some clinics and private health services offer full body CT scans or other comprehensive imaging as part of preventive health packages. Why it might be harmful? These scans expose patients to high levels of radiation. They often detect incidental findings, incidentalomas, that are benign but lead to further tests and procedures. The follow-up can include biopsies, surgeries, and treatments that carry risk but offer little benefit. There is no evidence that full-body scans improve outcomes or life expectancy in asymptomatic individuals. Expert recommendations. Major health organizations do not recommend routine full-body scans for healthy individuals at any age. What to do instead? Address specific symptoms with targeted diagnostic tests. Engage in regular health check-ins with your primary care physician to evaluate ongoing health concerns individually. The importance of individualized care. It's essential to recognize that these guidelines are not one-size-fits-all. A healthy, active 72-year-old with few chronic illnesses may make different choices than someone the same age with multiple health problems. Medical decisions should be tailored to an individual's health status, functional ability, life expectancy, and personal values. Informed decision-making between patient and doctor is key, rather than following blanket guidelines. Conversation should center on the potential benefit of a test in the context of the person's overall health goals. How to talk to your doctor. If you're unsure whether to continue with a particular test or screening, here are some useful questions to ask your doctor. What is the purpose of this test at my age? How will the results change how we manage my health? What are the potential risks of the test and any follow-up procedures? Do I have any symptoms that justify this test? Are there safer or less invasive alternatives? The role of preventive care beyond tests. Skipping certain medical tests doesn't mean giving up on preventive health. In fact, some of the most beneficial actions older adults can take don't involve tests at all. Staying physically active, eating a nutritious, balanced diet, managing chronic diseases like diabetes and hypertension, staying socially connected, avoiding falls, getting vaccinated, e.g. flu, shingles, pneumonia. Conclusion: turning 70 is a milestone that often brings reflection on health and longevity. While routine medical testing has its place, it is not always beneficial in older age. The key is to prioritize quality of life, avoid unnecessary interventions, and focus on tests and treatments that offer clear benefits. In reviewing the 5 tests we discussed, colonoscopy, PSA tests, mammograms, bone density scans, and full-body imaging, it's evident that the medical community increasingly supports a more individualized, conservative approach for seniors. It's time to shift from an automatic testing mindset to one of thoughtful, informed decision-making that prioritizes well-being and peace of mind. By being proactive and informed, you can make choices that align with your health goals and ensure that medical care remains a tool for empowerment rather than a source of harm.